Okay, today's video, I just want to make a little video about wound vac, just for benefit of those who have been asking me about wound vac. So wound vac is a machine or a device that is used to heal wound. It is used to heal wound internally. This machine is connected to the wound, you know, it's supplied by KCI. You see it mostly in a hospital, and some nursing home have it, because when I learned about wound vac, I didn't learn it in the nursing school. I learned it at work. Um, in the nursing home where I worked, the KCI came to teach us about that. So in a wound vac, we have a wound that either is bed sore, pressure ulcer, otherwise known as bed sore, or a surgical wound. So there is something like a sponge and a tube that is attached to that sponge. So this wound is put in. This sponge is put on the wound after they sometimes they put like some gauze or something to protect the wound. Then they put the sponge, which is usually like in a black color. So the tube is attached to it. So this tube that is attached to it, and there is a machine. When you turn it on, it is usually set at 125 mHg. So I think so when this is set in, there is something like a container that it goes in and suck in this fluid, excess fluid, which comes out at the beginning in the form of blood. This and the wound vac is a negative pressure which heals from the inside out. It's a negative pressure that heals wound from the inside out. So it's usually changed at least like once a week, or sometimes once twice a week. Uh, Sorry, not twice a week, but once in 2 weeks, um, depending on what the doctor orders. So so at this point, when it's changed, we throw away the canister where those blood, it's like a cup or something. How will I describe it? Where those blood or body fluid is sucked, that is sucked from the wound, goes into. Okay, so those container is thrown away, is disposed to the biohazard bag with everything that is in it. So a new canister is usually put in. So we don't let it get filled. You want to get to 3/4 to the full, you know. So if it gets a little bit above the half, we kind of disconnect it, throw it away, and then put a new canister where those body fluid and blood goes into. So it's a negative pressure that heals from inside out. That is what wound vac is. And for patient with wound vac, it's usually patient that has a surgical wound, patient that has a pressure ulcer, and patient whom has a wound that has been so difficult to heal. I think some diabetic wounds too, they usually put it. Not 100% sure about that, but I'm very sure about the surgical wound and the gunshot wound that we have used it. And the stage 4 wound is usually what they use. So this wound, stage 4 is the wound that is just close to the bone. You know, the first layer is the stage 1, then the second layer, when it gets to the muscle and all that, is stage 2. Then when it's the the third layer is like when it gets to the fat. Then the fourth layer is getting to those muscles and tendons. All right, so that's what it is. So when a patient is on the wound vac therapy, this patient is at risk for infection. One, infection can go through anywhere because there is an open skin, either in the process of changing that, maybe the nurse was not careful, either in the process of the repositioning the patient or something. Anybody that has an open skin is at risk for infection. Then this patient can also be at risk for pain, acute pain. So these are the care plan: management of pain, and then risk for infection. Then nutrition is another thing, because you want anybody in a wound to have food that is rich in vitamin C and then protein, because those are the things that help with healing of the wound. So good nutrition, good hydration, water, all those nutrition. It's good because when somebody is is having all this wound in their body, you need rehydration. And again, if also, I think incontinent care, if the patient is incontinent, it's a good care plan to put the patient in a dry, clean, and all that situation. So make sure patient is clean and dry, repositioned if the patient is incontinent, to enable the healing of the wound. All right, thank you guys, and I hope you enjoyed this video. Give me a thumbs up and subscribe.